The dental e-content for this month, August 2025, is based on science in oral medicine. So, what is a sign and importance of a sign? An indication of a disease detectable by a medical practitioner, even if it is not apparent to the patient, is called as a sign, according to the Oxford Dictionary. Any objective evidence of disease is supposed to be a symptom, which is by nature is subjective. For instance, the presence of frank blood in a stool is a sign, which can be recognized by the patient, physician, or someone else as opposed to the abdominal pain, which is a symptom which only the patient can infer. So that is according to the Webster's New World Medical Dictionary. So the difference between sign and symptom is sign is very objective and symptom is very subjective to the patient. So coming to the SOAP note, the components of problem involves subjective, objective, and assessment and formulating a treatment plan for the patient. There are different variants of signs, which includes anamnestic signs, cardinal signs, clinical signs, diagnostic signs, elicited signs, histopathological signs, medical signs, ominous signs, pathognomic signs, prognostic signs, prodromal signs, radiological signs, vital signs, and warning signs. So some of the classical clinical signs that is relevant to the aspect of oral and maxillofacial pathologies will be discussed in the following section. The first sign is called as Asbro-Hansen sign. The other name is Bulla spread sign. So this sign involves the spread of blister to the adjacent normal skin when a pressure is applied to the top of the bulla in case of certain vesiculobullous lesions, such as pemphigoid, that is bullous pemphigoid, dermatitis herpetiformis, epidermolysis bullosa acquisita, cicatricial pemphigoid, which is your mucous membrane pemphigoid, bullous truck eruptions. All these cases, these are blistering diseases which involve certain kind of dermatological component apart from the oral lesions. So this is a case of a classic Bulla spread sign. The second sign is axillary freckle sign, also known as crow's sign. It is characteristic of neurofibromatosis, showing caphylloid macules in the axillary of the armpit region. These macules almost develop years before the neurofibromas and can be distinguished from a freckle or a nephilus by their larger size and occurrence on areas that are not exposed to sun. So this is a sign called as Auspitz sign. It is characterized by the appearance, as you can see, some red glossy surface with pinpoint bleeding on removal of the scale by scraping or scratching in case of psoriatic lesions. So this is a result of the removal of the suprapapillary epithelium, which is followed by the rupture of the dilated dermal capillaries. So this is also elicited through a grattage test and can be seen in Darius disease and actinic keratosis. This sign is called as Bonbon sign. It involves typic orolingual movements of the tardive dyskinesia, some kind of, it resembles some kind of facial palsy. It is because of an involuntary pushing of the tongue against the inside of the cheek, along with chewing and smacking of the mouth and the lips and rolling of the tongue in the mouth. This is called as Battle sign. It was named after Sir William Henry Battle. It is a classical sign that occurs because of the fracture of the base of the skull. There is some kind of blood accumulation, some kind of, hemorrhage that is seen in the posterior cranial fossa region. So that is at the region of the mastoid process. So there is a discoloration. So this is a very highly specific sign and it's a very predictive indicator for basal skull fractures. Carpet tack sign, also known as cat's tongue or tin tack sign, is a useful clinical feature in diagnosing discoid lupus erythematosus. There are hyperkeratotic scales spreading into the follicular infundibulum. It produces keratotic spikes when viewed from the scales at the surface. It mimics like a tack of the carpet. It can be seen in lichen planus and pemphigus foliaceus. Chagas Mazza Romana sign, again named after the person Cecilio Roman. He described around 80% of cases in Chagas disease, that is an American trypanosomiasis. So as you can see in the picture, there is unilateral swelling of the eyelids and orbit after the conjunctival inoculation. So it is basically some kind of parasitic infection. Inflammation of the tear duct and the tear gland and the periauricular lymphadenopathy can also be visualized. Churstick sign, classical sign of tetany seen in hypocalcemia. It refers to an abnormal reaction due to the stimulation of facial nerve. Cluster of jewels sign, also known as string of pearls or rosette sign, refers to an early stage of chronic bullous disease of childhood when new lesions appear at the margin of the older lesions. So it resembles like a jewel, like a cluster of jewels, a string of jewels. So this peculiar appearance of vesicles and annular pattern along the edge of the lesion is frequently seen in linear IgA disease as well. Combi sign, classical sign of measles. It was described by the person, Sir Jules Combe. It comprises thin whitish patches, as you can see in the right buccal mucosa on the gingiva and the buccal mucosa. It is due to desquamated epithelial cells. Cordlet sign was described by Sir William Thomas Cordlet and is a contagious bulloso form of impetigo that is beginning on the face. Forsheimmer's sign refers to an enanthem of red macules or petechiae confined to the soft palate in patients with rubella. It can extend to the hard palate region as well. Godlin's sign, named after Sir Robert James Godlin, seen in patients with Ehlers-Danlos syndrome, extensive ability for the tongue. They can touch the tip of the nose using the tongue. Guerin's sign, named after the person Alfonso Francois Marie Guerin. So this is classical sign seen in Leafoot 1 fracture, bruising and ecchymosis in the palatal region due to the ecchymosis of the blood vessels. There is a greater palatine arteries. Hertog's sign or Queen Anne's sign is loss of lateral 1/3 of eyebrows, superior ciliary madrosis, seen in the following conditions such as leprosy, myxedema, ectodermal dysplasia, discoid lupus erythematosus, HIV infections, and certain cases of hypothyroidism. Hutchinson's nose sign refers to the presence of vesicles occurring on the tip of the nose in patients with herpes zoster. So this kind of sign indicates that the nasociliary branch is affected and eye involvement can be present or can be forthcoming. Hypopyon sign is seen in pyodermas and secondary infected vesiculobullous lesions like pemphigus bullous pemphigoid and linear IgA dermatosis. As you can see in this lesion, is again seen in the skin surface. There is transferred fluid level comprising of the pus or the purulent material at the bottom when the patient is in standing position. Jump sign is a classical sign seen in myofascial pain dysfunction syndrome, a part of the temporomandibular joint disorder. So whenever a myofascial trigger point is detected and palpated, the patient classically gives a typical behavioral reaction because of the tenderness on palpating that region. So this is called as a jump sign. So it is also characteristic of fibromyalgia of the cervical spine. Mouth mirror sign, there are certain tests to detect this mouth mirror sign, lipstick test and tongue blade sign. All these tests will indicate some kind of hyposalivation. Nikolsky's sign, one of the most important sign in oral maxillofacial lesions, especially in these autoimmune blistering disorders like pemphigus. The ability to induce peripheral extension of the blister as a consequence of applying lateral pressure to the border of an intact blister. There are different variants of Nikolsky's sign like marginal, direct, modified Sheklakov, pseudo, wet and dry Nikolsky's sign. Opalescent sign is violet colored teeth that have an opalescent iridescence, a sign of dentinogenesis imperfecta. It can also be present in osteogenesis imperfecta in patients with blue sclera. Panda sign or raccoon eyes, again seen in basilar skull fracture. It is seen as periorbital ecchymosis from subconjunctival hemorrhage, which happens as a consequence of the dissection of the blood from the disrupted skull cortex to the soft tissues of the periorbital region. Slip sign, it's seen in subcutaneous lipoma. When the edges are pressed, the edges are well defined, and when it is pressed, it slips away. Tetty's sign is the presence of small erosions of the molars and the bicuspids in the cervical region. The erosions are most commonly associated in certain liver diseases, like biliary diseases, when there is an increase in the quantity of biliary substances in the plasma. Trousseau's sign is a test for latent tetany. There is carpal spasm induced by inflating a sphygmomanometer cuff on the upper arm to a pressure extending a systolic blood pressure for 3 minutes because of the occlusion of the brachial artery. It's a transient sign. Vincent's sign is the presence of cuneiform erosions in the cervical region of the adulterated due to hepatopathies. Wegener's sign, seen in granulomatous lesions, that was described by Wegener, so it was named after this person. As you can see, there is extensive gingival enlargement along with granulomatous lesions, along with certain local factors. So this presentation, I would like to conclude by saying what the eyes cannot see, the mind does not know. So a thorough clinical knowledge is very important. So recognizing these signs can actually alter the treatment plan also. The patient can aid in the timely diagnosis of the disease and can help in the right intervention for the patient for improving the overall quality of life. These are some of the references. Thank you.